Now let's talk about the race for a vaccine with one of the few doctors who will actually determine the order of who gets that vaccine first. Dr. Peter Szilagyi is a clinical researcher and pediatric specialist at UCLA. He's a member of Governor Newsom's Scientific Study Review Work Group and advises the CDC on immunization issues. Doctor, welcome to The Issue Is. Thank you for the work you're doing. What a busy time this must be for you. All right, so the big question people want to know. When can I get my vaccine? How is this rollout going to work? Because we know healthcare workers get it first, but then how do you determine who gets it second, third, fourth, fifth?
Okay, so I'm a member of ACIP, which advises CDC, and we have spent 6 months deliberating who should get the vaccine first, given scarce supplies of the vaccine. We used the following principles. The first was science, so who is most at risk? For whom is the burden the highest? The second is implementation. How feasible is it to implement the vaccine? And the third and really important one is ethics. And based on those principles, we came up with the following order. Healthcare workers and residents in skilled nursing facilities should be the very first wave. The second wave is likely going to be essential workers. These are 87 million people who are essential for the economy, for society, to keep America going. And then there's 2 other high-risk groups, and those are adults with chronic conditions that place them at risk from getting COVID-19, so like heart, lung disease. And then there's 100 million of those. And then there are older adults like myself, adults over 65, and there's 53 million. So it's likely it's going to be staged that way. I predict about 40 million doses by very early January.
40 million doses by...
40 million doses.
So that would be all healthcare workers, all nursing home facilities, and then beginning the essential workers by January?
By sometime in January. Sometime in January, I think we will roll in essential workers. Don't forget, we need 2 doses.
Right.
For these vaccines.
How do you determine which worker is more essential than the other when you have 87 million?
That's a really great question. It's really hard. It's like a Solomon's choice, isn't it? To try to decide who gets it first. But something that's really important, this is not going to take years. I mean, we're talking about for the essential workers, if they come next, they may all be able to get it within a couple of months. So when we're talking about somebody coming earlier rather than later, we're only talking about a couple of months. I'm actually optimistic that by, maybe the summertime, July, August, we will be really heading out of this pandemic if the majority of people who can get the vaccine actually accept the vaccine.
Well, thank you for all that you do on this historic, unprecedented vaccine journey that we all are on. We really appreciate it.